Hey everybody, I'm really glad that you've tuned in to Fill in the Blanks. This episode is about how we can help our children and young people make up for the time lost learning and developing socially and emotionally while they were away from school activities and friends. Now, we recorded this episode earlier this year before schools reopened and prior to the Delta variant. And judging by the current mental health studies of adolescents, I do believe that everything we said is right on track and rings true today, just as it did when I recorded this podcast. I guess my next question, since I've got the expert of experts here, is what do you say to parents to do now to help manage this scenario? Because as we say, we've got parents that aren't educators. They, have 2.2 kids, a barking dog, a double income family. So they're both working outside the home, hopefully. They both have been able to keep some form of income flowing in. There is depression, stress, anxiety, worry about mortgage and things of that nature. Is there something they can do to minimize the gap, maximize the learning experience? Is there some formula, some piece of advice we can give to these parents to help them navigate this terrain?
So the first thing parents need to do is to give themselves grace. It's an extraordinarily stressful time. And all parents are not only dealing with their own stressors, but the stressors of their children. And they are worried. I get emails and calls from parents all over the country severely anxious about the impact on their children's mental health and on their cognitive development. We're all doing the best we can, and that's what's most important. In terms of practical advice, primary school kids may not find their Zoom talk with their teacher engaging at all. Don't worry about that. Don't try to force them to do it. They're not going to get anything out of it, especially if they're not interested. Better that you watch the content if you can and get some sense of how you can use those lesson plans in reaching your own child. Middle and high school kids can, to varying degrees, participate in distance learning. But again, every child is different and every family is different in terms of the resources they have, both in terms of social resources to support their children, but just also in terms of the technology and the bandwidth to allow them to even Zoom in. Again, do the best you can and give yourself grace. There's many of these things are beyond our control, and you can only control the things you can control. The final thing I would say, though, around children's mental health in particular, and this, frankly, varies with what a lot of public health advice publicly given is, and that is to identify a pod for your child or for your family so that you can have contact with people outside of your family, and particularly that your children can have opportunities to play and interact with kids their age outside of the family. Zoom play dates just don't work for primary school kids, for toddlers. They need to be around other children, and we need to create opportunities for them to do so. So find another family or two that shares your values, that are very careful about their own mitigation strategies, that would alert you if they were ever exposed to anybody that was sick, that doesn't socialize with other people outside of the pod that you've created, and try to find opportunities for you guys to get together. Ideally outside, if possible, for the kids to play, if you live in a place where the weather allows it, but inside if necessary, masked if possible. So I think this is something that we really need to be doing. Many people are doing it, but the problem is because without sort of very discrete advice, people are doing it willy-nilly. This is the big concern I have, Dr. Phil. This pandemic fatigue has set in. The fatigue makes people do things that they shouldn't do. We need to do this safely and in as protective a way as we can. And I can tell you that not only have my family's created a pod, most of my colleagues have. We don't talk about it publicly. There's no public health official saying do it this way, but I think especially for young children is something that we need to do.